Hello guys, welcome to new clinical session. Today we will discuss a clinical approach in emergency department. The name of this approach is A.Enki Ishtar emergency approach. Is used for non-traumatic or stabilized trauma cases. Mythological introduction: in old Iraqi region, gods represent the force that sustain life. So we have many gods, like Enki is a god of life, and Ishtar is a god of love and care and awareness. Again and again, same thing I say before. Enki Ishtar emergency approach. The approach divide in two stages: Enki stage and Ishtar stage. Enki represents for immediate survival priority, what we'll call patient first. Ishtar stage represents for deep understanding why is the patient suffer and what are we missing. Pre-Enki stage. Please, first of all, you should be smiling. Patient is a human and we are human. So start with smiling, try to calm the patient and let him to breathe well and tell him everything will get better and we are here for him. This is good to build a relationship between doctor and patient and will create trust is very important one. Okay. After that, symptomatic treatment. If patient in pain, give analgesic. If vomit, gave antiemetic. If dizzying, gave O2. Then start an anxiety stage. The rule of life. The patient cannot die soon if he has lung to breathe and heart to pump blood. In emergency department, cardiovascular assessment is critical for all patients present with any complaint. This includes palpation of the pulse, evaluate rate, rhythm, volume, measure blood pressure to assess hemodynamic stability, auscultate the heart to detect a murmur or abnormal sound, and 12 lead ECG to identify any arrhythmia, ischemia, or any other change. Respiratory assessment is also very important. Start an inspection, look for chest, if he elevated or not, then palpation, then auscultation is very important one, look for air entry, look for any abnormal sound. Chest X-ray should be done when clinical findings suggest respiratory or cardiac involvement, like dyspnea, hypoxia, or any abnormality in a clinical examination. Then, quick history involve A for allergy, medication, past medical, last meal, and events. If everything look normal, take deep breath and take time to get to the diagnosis. So we will start an start stage. To diagnose any patient, the initial question you should ask is condition organic or not. The patient may be present with complaint like hematomesis, but maybe patient take or ingest substance reticular rather than real bleeding. This suggests a factitious disorder. Even when conclusion the complaint as organic cause, it remains essential to consider possibility of non-organic comorbid. If patient delay in response to question because take time for think about what should I say, or change in medical history from time to time, or exaggerate in expression, or change in facial expression, or the clinical history does not match the laboratory finding. Sometimes patients present with multiple complaints and multiple symptoms. Possibility should be considered. Even the patient have multiple disease or single disease maybe affect multiple symptoms, or patient maybe have somatic symptom disorder and patient maybe give inaccurate or misleading information. All these you should consider in your mind. To rule out of organic cause, you should do full history and examination. In the skin, look for any change color, any sign of anemia, any sign of dehydration. Okay. Head and face, rule out any fracture, laceration, bruising, and neck. Look for any neck injury. Chest, rule out of rib fracture. Abdomen, rule out of abdominal bruising and tenderness. Back by log rule, 4 people are required. And in same position, do BR exam. Extremity, each limb should be examined for tenderness, for any abnormal movement. Then a neurological exam, look for any sign of upper and lower motor neurology. Extend vital sign is a part of Ishtar stage. Vital sign is 10, not 5, so you should do all of these. After that, we have 4 options: refer, observe, admission, and discharge. At the end, some of clinical notes. Don't use leading question like, does the pain radiate to your left arm? Even if there is no, the patient will say yes. So you should use open question. Where does the pain go after it starts? Note number 3. In history taking symptomatic review, we exclude each disease separately by mention specific sign and symptom. And session advice. Lifestyle modification is key for all disease. End of presentation. Thank you for listening.